Ouch! We've all been there, right? That instant jolt of pain. Whether it's a clumsy moment, a kitchen mishap, or pushing yourself too hard in sports. Pain is a part of life. But what happens when that pain doesn't go away? When it happens day after day, month after month. That's what we're diving into today. Understanding and managing chronic pain. Most of the pain we experience is acute pain. It's intense but temporary. You might feel it for a few moments, days, or even weeks, depending on the injury. But eventually it heals and the pain fades. Chronic pain, on the other hand, is a different beast. It's defined as pain that lasts for more than 3 months, even after the normal healing process should be complete, or even without any apparent initial injury. The impact of chronic pain is huge. We're talking about millions of lives affected. It's estimated that over 50 million Americans suffer from chronic pain. 50 million lost workdays each year. 1/3 of American adults lose more than 20 hours of sleep each month because of pain. Chronic pain can be overwhelming, impacting your relationships, your work, and your overall quality of life. But here's the good news. You can learn to manage it. So, what's actually happening when you feel pain? When you get injured, special nerve endings send messages to your brain, telling it there's damage. These specialized nerve fibers instantly tell your brain where the pain is, how intense it is, and even the type of pain. Is it sharp, burning, throbbing? Your brain then sends back a message, telling you to stop doing whatever's causing pain. If you touch something hot, your brain tells your muscles to pull your hand away. Once the cause of the pain goes away, your brain should tell those nerve cells to stop sending pain signals. But sometimes that mechanism fails. It's like a gate stuck open. For some reason, your nervous system keeps sending pain signals to your brain for months or even years after the injury heals, or even when there hasn't been any bodily damage. This is the foundation of chronic pain. Pain isn't just a physical experience. It's deeply intertwined with your emotions. Everyone perceives pain differently. Your upbringing, your past experiences, and your current emotional state all play a role. Long-term pain can lead to frustration, irritability, and even depression. You might even fall into what's called a sick role, where you feel like a victim of your pain. While this might bring some attention, it can also lead to inactivity, isolation, and actually increase your perception of pain. Stress and unhappiness also tend to amplify pain and lower your tolerance to it. That's why finding positive ways to cope with your pain is so crucial. So, what are some of the most common types of chronic pain? Back pain. Lower back pain affects millions and can be related to muscle strain, poor posture, or spinal changes. Headaches. Tension headaches are the most common type, and migraines can be triggered by genetics, diet, or stress. Arthritis. Arthritis involves inflammation of the joints, affecting the hands and feet. These are just a few examples. The key is that chronic pain can become debilitating, but effective management is possible. Studies show that aerobic exercise can stimulate the release of endorphins, your body's own natural painkillers. Doing low-intensity aerobic exercises for 30 to 45 minutes at a time 5 or 6 days a week may produce an effect. Be sure to build up slowly. Stay active. Try new hobbies. Find activities you enjoy. Focus on others. Get involved in volunteering, community events. Shifting your focus can make a huge difference. Accept your pain. Be realistic about what you can do, and don't overcommit yourself. Stay healthy. Regular sleep and a balanced diet are crucial. Relax. Muscle tension increases pain awareness. Massage, warm baths, and relaxation techniques like deep breathing can help. Keep a pain diary. Pain diary can be helpful when you are communicating with your doctor about pain. You need to write a detailed description of your pain while you're having it and describe location, intensity, and frequency of your pain and what makes it better or worse. Advances in medicine have given us a wide range of treatment options for chronic pain. Surgery. In some cases, surgery can help relieve pain, but it's not always an option. Interventional approaches. This can involve injections or medication at or near the site of the pain. Medication. Many different drugs are used, depending on the severity and cause of the pain. Physical and occupational therapies focuses on reducing pain through exercise, flexibility, and proper body mechanics. Cognitive and behavioral therapies helps you understand your behavior, feelings, and how they relate to your pain. Complementary and alternative therapies. These can be effective for many people. If your pain changes in character, escalates, or you develop new symptoms, it's important to see your doctor for a reevaluation. Chronic pain can be challenging, but it doesn't have to define your life. By understanding your pain, exploring different management strategies, and seeking professional help when needed, you can take control and live a more fulfilling and enjoyable life. Don't forget to like this video and subscribe to our channel for more health and wellness tips. And share this video with anyone you know who might be struggling with chronic pain, you're not alone.